Hi, I'm Dr. Bailey. Nasal congestion in an infant can be one of the most terrifying and common issues that parents deal with. There are a whole bunch of products out there that claim to treat nasal congestion. As a pediatrician and a mom, I'm going to share my go-to treatments with you. First off, the American Academy of Pediatrics does not recommend that you use cough medicines to treat your baby's cough. This is because small children and infants tend to cough for a reason, and the cough medicine can mask those causes. For instance, some parents complain that their children have a cough and it's related to an issue with the lungs, while other causes involve increased mucus in the nose and the upper airway. Because a problem with the lungs can be life-threatening, we pediatricians need to be able to pinpoint the cause to treat your child as quickly as possible. A way to pinpoint whether your child's cough and symptoms are caused by the lungs: take off your infant's or child's clothing. Look at the movement of your child's ribs and their belly. If the skin in between the ribs sucks in deeply when they take a breath, and their belly is moving in and out at a rapid pace, or if you see your infant's nostrils getting very big with each breath, then call your pediatrician and head to the nearest urgent care or emergency room, as these are signs that your infant may likely be in respiratory distress. Generally, with nasal congestion, your baby may seem more irritable. Parents ask how to tell whether or not your baby is nasally congested. Just look at them when they feed. Does your infant struggle or start to feed and then turn away, or cry out when feeding in frustration, only eating after a short time? Well, if they're doing this, it's likely because their nose is stopped up, and babies breathe through their nose when feeding. Simple enough. You may also notice that your infant appears fine until you lay them down at night, and then the coughing begins. Why does this happen? Well, your infant is nasally congested, and laying flat on their backs causes the mucus in their nose to drip down the back of their throat, almost like a water faucet. This causes the baby to cough intermittently and can sound like the cold is stuck in their chest. However, if your child has none of the lung symptoms that we talked about earlier, then it's time to treat their congestion. So, what do we use to treat infant congestion? So my go-tos have to do with what causes the symptoms. You have to get rid of the nasal congestion, period. Because mucus builds up secondary to the body defending itself from a number of different causes, it will likely keep producing for some time. Therefore, even if you are clearing the mucus out for a day or so, please don't expect your baby's nose to simply clear up and everything to be resolved in a day. Viruses tend to last anywhere from 7 to 10 days. Kids are virus magnets, so start strengthening those hands for the cold season. First off, we're going to discuss bulb suction. So our first treatment for nasal congestion is the handy bulb suction. Generally, parents get these at baby showers and even in the hospital. I'm showing you an upgraded one from NeilMed, which has a curved tip, so it's easier to go into the child's nose. This is the bulb suction that I recommend for infants. So these would be babies anywhere from 0 to 6 months of age. Babies at this age tend to not have as much head control, and it's easier to hold their head stationary and really get into their nostrils. To use the bulb suction, you're going to simply squeeze the bulb suction and hold it until you come to your baby's nose. Insert the tip into the congested nostril and release the bulb slightly while still holding. The negative pressure from the bulb will suck out the baby's mucus and should help ease their symptoms. So what happens if nothing comes out? Aha! If nothing comes out, then try your initial technique once more. If that still doesn't work, then go for the nasal saline drops. You can get these anywhere, and there are all different types of brands. I recommend the non-high flow saline spray for young children, as babies tend to be more stationary. So what you're going to do is add 1 to 2 drops to each nostril, and then wait about 30 seconds for the saline to work its magic. You do not have to hold the child down during this time. You can just kind of ease up and let them do whatever they need to do. This saline will cause the mucus to liquefy and break up, making it easier for you to then suck out. Now, for older infants and toddlers, parents cringe at doing this. Every parent has been there. It's late, your baby is cranky, fussy, and won't go to sleep. You're tired and you want to bulb suction, but you know that there's going to be some sort of sumo wrestling style contact involved. I gotcha. No one likes doing this. For single parents, this is even harder because you really need a team of 2 parents, one to hold the head and the other to hold the body. I never condone using aggressive holds for kids because it can be traumatic. So I have my favorite go-tos for you and your child to avoid mortal combat. The bulb suction that I like to use is a nose Frida or one like it. It has a long tube connected to a filter and a long hose connected to a mouthpiece. A lot of parents cringe at this, but my friends, this is gold. Let's say that you have a cranky toddler who's fighting you at night. Now you have to have dexterity, but you want to put the mouthpiece in your mouth first while the child is laying down. You really only need to get the tube close to the nose before you start to suck through the mouthpiece. The give on the hose gives you more leeway to keep the tube near the nostril, even if the child is kicking and screaming. Now, if you've tried this with your toddler and nothing comes out, it's time to get the nasal saline. No, not this one. This nasal saline. We all know that toddlers move and time is of the essence. You want to get the nasal saline with a depressor or a high flow nasal saline so that it shoots into your child's nose before they can move. For this, you hold the child gently. You can even let them move and shoot into each nostril. You'll again wait for about 30 seconds. If they get up and run around, you can catch them, but the saline should have gotten up there. Kids tend to respond negatively to more pressure, more physical pressure. So ease up, give them a break, and then re-engage. Too much engagement or pressure holding will lead to increased parental frustration, and your child will be very frustrated as well with a stuffy nose. Other things that I recommend to fight congestion include salves. Vicks Vapor Rub, Baby Bliss, Highlands, Zarbee's are all types to use. For infants, please make sure to avoid salves that have a majority of menthol in their ingredients, as this can irritate baby's skin. You want to rub the salve on the chest and the bottoms of the feet. Please also put socks on the feet to help. Eucalyptus oil can also be used in a diffuser in the room. A cool mist humidifier can help to moisten the passages for your child to breathe. And there are a host of mini Vicks and equivalent products to put in the room to help as well. We recommend cool mist humidifiers because the warm moisture of the heated humidifiers are a potent medium for the development of mold. Even if you do have a cool mist humidifier, please check the factory instructions for cleaning, as this can also cause mold production if the humidifier is not cleaned frequently. So, research has shown that honey has been the only effective treatment for children's coughs. In children under the age of 12 months, please do not use honey at all, as it can cause botulism and be life-threatening. So, the theory behind these natural cough medicines is that it soothes or heals the throat in infants. This works great if your child has an irritated throat and nothing else. However, this is generally not the case. Instead, it is the mucus accumulation that causes your child to cough, as we discussed earlier. So, even though you are giving the medicine to soothe the throat, the mucus is still dripping down the back of your child's throat and causing them to cough. So this is why your child has the congestion, even though you're using the medicine. For more information, please visit our website at www.askpeds.com and check out more helpful videos on our YouTube channel. Feel free to subscribe, as we will keep creating these educational blurbs to help. We look forward to hearing from you. Take care.